I'm Charlene O'Reilly. I'm an Associate Professor in Human Nutrition and Food Science at University College Dublin. I'm also the Project Lead for the Impact Diabetes Bump2Baby and Me project. What is the Bump2Baby and Me Health Coaching Programme? Well, the intervention tested in our trial was called Bump2Baby and Me. And the programme was delivered through a user-friendly smartphone app and also provided live health coaching from a healthcare professional. This novel intervention was designed to offer continuous support and guidance on making health-related behaviour changes during pregnancy and the first year after the woman's child is born. We developed Bump2Baby and Me as an intervention to empower women by providing them with the best evidence-based knowledge and tools at the right time to help them make informed decisions about their own health and well-being. The aim of the intervention was to improve numerous outcomes, those related to gestational diabetes, weight management, sleep, mental health, diet, and infant development. And we did this by providing more active health behaviour change support. What is the trial about? Well, during 2021 and 2022, we recruited 865 pregnant women who were at higher risk of developing gestational diabetes during pregnancy into the Bump2Baby and Me trial. The women were recruited across 4 sites: the National Maternity Hospital in Dublin, Ireland, South Meath Hospital in Bristol in the UK, Clinical University Hospital San Cilio in Granada in Spain, and Monash Health in Melbourne, Australia. When a woman agreed to take part in our study, they were randomly assigned to either the control group or an intervention one. Randomization is where a participant is assigned by chance to different groups, and neither the researcher nor the participant chooses which group is allocated. Women in the control group received usual care, in other words, the care they would have normally received in their maternity service, and the women in the intervention group received usual care plus the Bump2Baby and Me Health Coaching Programme. Having 2 groups enabled us to analyse the differences and therefore the impact of the intervention. What information was actually collected? We have a big bank of information on the women's health, their well-being, their sleep, its quality, nutrition, physical activity, as well as their children's feeding and breastfeeding patterns, the child's growth and development. The data was collected using questionnaires and self-reported weight measurements during pregnancy right up to the baby's first birthday. We collected blood samples at the start and the end of the trial, and we're going to analyse them to examine the glucose, insulin and cholesterol levels. The main question we wanted to answer from all of this data was whether the women in the intervention group gained more health benefits from the Bump2Baby and Me Health Coaching Programme than those who were receiving only usual care, and how the measures of health changed over the course of that intervention. What's next? Well, project partners are currently working on analysing that big bank of information to see if the Bump2Baby and Me Health Coaching Programme does improve health and if the intervention is cost effective. An implementation toolkit will also be developed, and this will provide stakeholders with full details of all of the lessons we learnt over the course of our project. The full results will be available by the end of 2024, But until then, you can keep up to date by following us on X, formerly known as Twitter, LinkedIn, or via our project website.